Good morning or good afternoon, everybody, and thank you for being with us today. My name is Carlos Lescharn. I am the Executive Director for Sales and Support for Latin America and the Caribbean and Spain and Portugal for Variant Systems. And today we are going to be talking to you about our platform and a solution for not only COVID-19, but also one of the biggest issues or questions that we're all looking at is once this is starting to get better and we need to come back to work, how can we do that? How can we work with our people? So during a pandemic containment, assisting in the containment is very important. Maintaining the quarantine, obviously, all communications need to be from a single platform. This is very important in order for you to avoid any form of misinformation. Also, the report that you generate out of the platform, how what exactly are you looking at? The numbers. People, every time people wants to have more and more information, more visibility of what's going on. And you need something that is centralized, that is able to give you that information and those reports. Also, visualization and management of the outbreak. How how you manage everybody that you have on the field, how you manage all of your patients, how you manage your resources, and also visualize the multi-organization field response that you need. In many countries, there's some countries that you have a unified system in which everything is all together. But in most of our countries, we have multi organizations that they're looking at everything. So we have fire departments, we have police, we have first responders, we have civil defense, we have health ministries. All of these organizations need to work together in order to be more efficient. NowForce, our platform, variant platform, is composed of three different devices. You have an application for your citizens that has two buttons. One button is your report um, button, in which that the all the patients, and we're gonna see some details about that. It also has an SOS button or a panic button. It is composed also of the main operator screen. In that main operator screen, the operator has the ability to see all of the active cases as well as all of the active personnel and or vehicles that they have on on the road, that they're able to track and they're able to communicate. Once there is an open incident, you can communicate with the patients via video, via phone, or text, or combination of both. You can also do an integration with an existing call taking system, like, for example, Avaya or Cisco, DBX, and have it as part of the system so that not only persons with cellular phones, but also people that have landlines can communicate. And then you have the third item, which is similar to the citizens application, but for the field personnel, it has also the ability of receiving all the information from the command and control, receiving also addresses and maps of where they need to go, where are they located, and where do they need to go. This works with both Google Maps as well as with Waze. So It is in some countries, Google Maps are not very effective. In some other countries, Waze is more effective. So you can use either or both, and gives you the ability of having a better control of your field personnel. This application also, you can send to the field personnel information on the incident, on the patient, and on any additional information that we may have of the case. You can also have your operating procedures being sent to the person in the field, and that way that person receives their instructions and they know exactly what to do, step by step. Each of these communications, everything is recorded, everything is saved as an incident, and later on we can review them as KPIs. When looking at the citizens, we can build a format for the citizens in which those that are affected or infected at home, we can send them a daily or twice daily form that they need to open up, and that way they can actually respond. Are you okay? Do you have a fever? Do you have pain? Has anything changed in your household? Anything like that. At the same time, you can also have selective messaging to them. You can communicate directly, or have a doctor or a nurse communicate directly with them, or you can have the field personnel go and visit them. At the same time, that SOS button is if they feel bad, if they don't feel correct, they can press the button and immediately it will open the camera and the microphone from their cell phone into the operator's screen, and the operator will have full communication with them. It also works with remote devices like Bluetooth devices. For example, those keychains that are Bluetooth. Also with the new digital iWatch and Samsung Watch and Android watches that are connected to the phone, you can have them also as triggers for the system. For the quarantine citizens, not necessarily they are infected, but they are quarantined. We can actually communicate with them. We can send them information about what we're doing in the pandemic. If they become infected, what is the next steps to follow? If they need to do additional testing, if they already left, if we have already found out that they are completely out of danger, and we need to follow them up in terms of, one, making sure that they recheck themselves periodically, at least twice in 14-day period, and then also afterwards, if they want to donate plasma, or we need them to donate plasma, we know who they are and we keep track and inform them of everything that is going on. For the uninfected citizens, this platform is also an informative platform. They can receive notifications on a regular basis. What is the situation? How are we tending the pandemic? What is being done about it? And how are we going to, effectively inform them as a unify, as all the citizens, all at the same time. The system has the ability of sending selective messages or sending broadcast messages throughout, and that way is very effective to maintain one line of information. This feature, talking outside pandemics and COVID and all this, in the Caribbean especially, when we have hurricanes, when we have other natural disasters, this is one of the best ways to make people aware of what's going on, because we can send notifications to all of them. One of the concerns that many people, especially the citizens, will have is, oh, but I don't have a contracted cell phone. I have a prepaid cell phone. So my data is limited. According to most countries, this application can be considered an emergency application. Therefore, the um, service providers cannot charge additional for the usage of data during the usage of this application. There's arrangements between governments and the ISPs, and most of the time this application is considered an emergency application, but it can be used in many ways, in many formats. For the field personnel, like I mentioned before, will receive a notification. There's a case open for you. They say, okay, I'm going. It opens a map for them, telling them where they are, where they need to go. And from there, it starts. Once they arrive to the location where they need to move, they press I arrived, and immediately they can start transmitting video, transmitting audio, texting, exchanging information with the command and control, with doctors on the field. Let's say that you have sent a nurse to a patient's home, and that patient is infected, and they can send immediately, okay, these are the vitals, this is the situation, and you can also escalate from directly. The field personnel can do escalations. Let's say that they decided that they need to take this patient to a clinic, so they can escalate the case so that it arrives in the clinic, and the clinic is already waiting for them because they have files and everything that they have found. As I mentioned before, the system has the ability to generate reports and business intelligence reports. That way, you can be informed how many cases are open, how many incidents you have right now, who are the field personnel that you have active, who have attended the most cases, etc., etc. You can have heat maps, you can have graphics generated from the system that you can use internally, or you can use to inform the population of what's going on and how are you taking care of this. Now, all of this is concerning the pandemic. But one of the biggest issues, or one of the biggest concerns that we have today is what happens when we reopen and when we bring back and we start looking at people coming back to work. That's when your profile of risk expands exponentially. Why? Because, okay, you can control your employees up to a certain point. You can take their temperature, you can monitor if they're sick, send them home, and you follow up with them at home. But sometimes this is very difficult to maintain that. At the same time, it's even more difficult to control, okay, they went out, they went to the supermarket, they went to a restaurant, they went somewhere, and you don't know who they've been close to. So it's very important for you to have some way of control this and utilize. And this is one of the biggest concerns of all the industries right now around the world, is when we come back, what are we going to do? So restarting operations, we need to take a pragmatic approach. The first one is we need to identify what is your most mission critical challenges that you have, whether it's your employees, whether it's your operation, the way you were operating before and how you need to operate today. And you need to start focusing on items that you can directly control. That's the first thing that you need to do. And then simplify. Make it simple, make it as much automated as possible. Be able to document. In many countries, the different health ministries are issuing or have issued already um, proposed policies and procedures for the different businesses when they're reopening. So you need to make sure that you comply with all that and maintain your status within your environment. So when we talk about the workplace and health solution, we are looking at NowForce as your incident management and response. And then we're looking at all the situational awareness and the platform that is called, we have a platform that is an ISOC that can combine all of your different company sensors. For example, we have several manufacturing facilities that have different sensors on the field, on the floor, and they are attached to cameras. That way you can see when something fails, you have immediate control. You can bring alarms to the system. You can bring SCADA systems, and there's a lot of different features. But right now, we need to protect our employees and visitors. We need to take a quick adjust to changing our requirements to them, and we need to still confidence in our employees that they are safe, that they are in a safe environment, and confidence to our customers that we're going to continue servicing them in a safe and scalable environment. All of these platforms are scalable, so you can start small and grow as you need. I'll give you an example. We have a city in South America that right now, they started about 3 years ago with a very small sample system of 100 citizens. Today, the system is running at 3,000, and the next, no, sorry, a million, and the next level is to increase it to 1,500,000, which is being done right now in the next few days. One of the advantage of our situational or of our NowForce system is that it's SaaS. It resides on the cloud, so it's very easy and quick to deploy. When talking about workplace, so we have the same 3 different modules, but this time we're using them in a different fashion. The module for your employees, where you can send them questionnaires. How you feeling? Do you have a fever? Have you had a fever in the last 24, 48 hours? Have you or anybody in your home been infected, et cetera, et cetera. You can control your policies. You can have process automations. You can centralize all of your security functions within one system. You can keep privacy and you can ensure privacy. You can have, for example, automated access control systems using QR systems, or using face recognition details, or using fingerprint, or any other form of access control that you may have. You can integrate to the system and make sure that depending on the questions that they answer, sorry, depending on the questions that they answer to you, you're going to be able to see that, and for example, generate a QR that when they come back to work, they use the QR to work, or generating a special code that they need to enter in the access control that will give them access. Or that way you have full control of your operation. And you can keep track of who's recovering, who's healthy, who is quarantined. In many countries, when you have quarantine personnel, they cannot work, not even online. For example, the case of Brazil. Brazil, if you have a quarantine employee, that employee cannot be even remotely connected to any system in the office. That way, the government says that you are sure that they have plenty of time to recover and everything. Um, or you can have close monitoring, must regulate the facility because they're sick. So you have all of these different features that you can keep track of, both inside and outside your operation, reducing the risk of larger population, improving the communication with your employees, and having an engagement with them on a regular basis, and simplifying the process management. That being said, when they come back to work, how do we control that? So you have prevention. Right now, you're looking at several systems in that are being advertised. Different companies that have thermal cameras that can take the temperature of a person. You have thermal totems that is a little unit instead of a camera. It's a little tablet that will take the temperature immediately when you're facing it. You can have face recognition systems. You have a combination of video, your video surveillance, or you can have, there's a lot of conversations now about having Bluetooth from your phone that will activate whenever you are too close to somebody, or that it takes initial symptom assessment depending on what you answer. So all of these systems can be integrated to the NowForce platform, and you can have a better control of not only your employees, but also of your visitors. When you're looking at visitors, is very touchy, is very delicate, because let's say that you have cameras taking the temperature as they enter to your building, and the camera determines that this person has a higher than normal temperature. And you don't want to obviously um, embarrass them as they come into your building, but you need to direct them to a specific place. Please come and talk to my colleague here. They will take your temperature, and the system is reading higher temperature. We all live in the Caribbean. I'm originally from Puerto Rico, and I grew up in St. Thomas and St. Croix. And outside temperature, as we all know, during this time of the year, can increase anybody's temperature dramatically. So there's always the possibility of a false positive. So we need to make sure that when they come in, that's the way. Now Force can interact with them, can interact with the integrated scanners that you have, with temperature screening systems, with the video cameras, all of that. And then you can give them access to your system. Also using access points together with Bluetooth. You can control inside your offices your proximity. The new term or fat phrase in the market, social distancing. You can keep track of social distancing by having people when they're in the office. You can have a combination of using their cell phones to keep track that they're not too close to each other, or using video analytics that will let you know, hey, you have more than 10 people and they're too close to each other in one room. For example, in the cafeteria or in a coffee stand or the water stand. It's very easy. People tend to forget that we're still on a special case or in a pandemic case. So it's very easy to forget that you need to keep a distance, that you cannot be in enclosed environments, hold everybody together. Like I mentioned before, the system is unique. The system is scalable, it's adaptable. So it gives you the flexibility to integrate it with different things that you already have. You don't need to add anything new. But if you do, you can bring it into the system and it will give you full control of your situation, protecting your employees and your visitors, making sure that you are in compliance with the requirements of the law, and again, instilling confidence in the return to work to your employees and instilling confidence into your customers and visitors. So at the end of the day, the biggest question always is, what is your most mission critical challenge? How am I going to bring back all these people? And NowForce gives you that ability. So looking at compliance, in many countries we have some regulatory agencies, compliance examples, for example, situational awareness to keep employees and visitors informed. We need to open a communication channel with the visitors and with the employees. In many cases, visitors will need to make an appointment to come in. It's not, in the beginning, it's not going to be open doors and everybody can enter at the same time. We need to control the visitors in the entrance and make sure that nobody is exposed, that nobody has a temperature, etc., etc. We need to actively monitor the risk of contamination. We need to keep track of cleanliness and making sure that in any case that there has been a visit, that immediately after the room where we're using to receive our visitors, it's cleaned thoroughly in order to receive the next visitor. Make sure that all visitors to the facility are monitored at all times, making sure that they can be tracked within your building. Also, if there is a panic of a possible infection or a possible contamination in one of your facilities, you need to have a plan for checking all of your employees, making sure that they go home accordingly, making sure that you have SOPs or response, organized response or system operational procedures in place that you can follow up, and everybody is informed of them. Everybody knows what they need to do and what is expected of them. We can execute pre-arrival with visitors. We can execute pre-arrival and triage with our visitors, as well as access control to all locations. We can inform all relevant personnel if they had been at risk and advise them of what are the next steps. How do we evacuate building? How we need to move along? Or remote employee monitoring as well. If we have certain employees that cannot come back to work yet, how do we monitor them? How do we need to keep in touch with them on a constant basis? So it's an end-to-end approach. As we mentioned, it's flexible, scalable, and adaptable, where you have your employees, their well-being, symptoms, assistance requests, everything is controlled through one platform. That way you can control everything. You can control it from your business. You can control it from home. Since it is on the cloud, it's very easy to move it from one place to the other. Let's say that you're not yet going to open operations and you cannot be in the office, but you can be from home operating and monitoring all of your employees. Let's say that you have, for example, we have one large customer is an energy company. This energy company cannot close their operations. They need to be active constantly. So we're monitoring not only the well-being of the employees, but also where they are at all times when they are on the field. So we're tracking the repair crews at all times. We're tracking their vehicles at all times and making sure that everything is completely under control. So you have data visualization, you have policies and procedures that you can follow and you can monitor, and you can have everybody on the same board. You have dashboards for administrative in order to manage all your functionalities. You have dispatch, you can do investigations, you have centralized messaging that you can send to everybody. This way, you can keep track of everybody. And then, besides that, you can have, uh, with our situational awareness platform, you can have, let's say that you can have our VMS, our video management system, or you can have you have your own video management system already in place, and we can bring it into this platform, and we can bring the video cameras, the fire suppression, thermal imaging, facial recognition, license plate recognition, or any other sensor that you have that you need to manage. And this way you can manage it all within one platform. And it gives you full control of everything, not only of your business, but also of your personnel. Many of the questions are regarding data security. All SSL communications between the application and the servers are controlled at all times. All strong passwords, tools for the command center. So each operator have their own login, and we can track when that person log in, when that person log out, how long were they, what type of incidents they managed on the times they were there. The employees that are connected, we can tell when they're connected, and if they disconnect their system, let's say that they turn off their phone, or for some reason their system provider, they don't have service where they are, we can tell where they were at the last point of transmission. We can prevent duplication of users. That way we can make certain that whoever it is connected to the system is the right person. We have secure servers. The system is designed under ISO 2701, but we also comply with other system and servers regulation. We use Amazon Web Services for our cloud. This can also be installed in private clouds. Let's say that you have Microsoft Azure, and we can install it in there. Or you're using the cloud from a local telephone company. It can also be installed in those servers. We also have all of these different supporting high standards of security for cloud services. Our AWS cloud servers comply with ISO 2718. And we have certificates that, if required, we can give you copies of those certificates as well. That's all for now for my presentation. Any questions? Camila, I don't know if they're open to ask questions or send questions. Okay. So if you don't have any questions or any comments, I guess this is all for today. We have a complete, we're more than happy to answer to your questions if they arise later on. Full Protection is one of our biggest partners in the Caribbean, and we work with them very closely. As you know, they have a complete solutions for all of these different items that we have spoke today, not only for our platform, but from third parties that we can integrate into our platform. And they can have their engineers design for you a complete solution for your needs. Any questions, I'll be more than happy to answer. If not, thank you very much for your attendance, and thank you very much, and stay safe, please.